This week in Community Connections, we call in and talk to Julie Moore about what's going on with the Indiana Alzheimer's Association and their upcoming walk on October 6th at Bankers Live Fieldhouse. Here's how our call went. Good morning, Ms. Moore. Could you begin by just telling us what the Alzheimer's Association does, specifically your Greater Indiana chapter?
Absolutely, I'd be happy to. The Alzheimer's Association mission is three-pronged. We fund research to help lead to the first treatment or ultimately a cure for the disease. Right now there's nothing that can help be an intervention for the disease. We also provide care and support for all people affected by Alzheimer's or other types of dementia, both the person living with the disease as well as their caregivers and family members. And finally, we promote healthy lifestyles and brain health in order to hopefully prevent mild cognitive decline in the future. So those are the three things that we do, and I can certainly go into more detail about what that looks like at the local level, but those are the three areas of our mission.
That is awesome. Do you specifically have any personal connections that drew you into being involved with this organization and with the Alzheimer's community?
Sure, absolutely. In my family, luckily we haven't had a long history of it, but my grandmother does actually have vascular dementia. So she basically has the symptoms of dementia due to cardiovascular events, and so that's been something relatively new to our family. And what I've figured out since I've been with the association is that there's not a lot of resources out there for this disease, for families to navigate. There's not a lot known because even our organization is a fairly young organization. We're founded in 1980. And so I just am really passionate about the work that we do because there's so much that needs to be shared with families, and they need to not have to go through this journey alone, and there needs to be answers. And so I feel like we are able to help significantly help families through this journey.
Yeah, and on that note, you just said that there's not a lot that families can do to help with the organization, or not help with the organization, but help with the Alzheimer's prevention. What is your organization doing to give them those opportunities?
Absolutely. So one of the ways that we provide care and support is that we have licensed clinical social workers on our staff. So I guess I should backtrack and say the Greater Indiana chapter covers 73 of the 92 counties in Indiana. And so our licensed clinical social workers will sit down and meet with families that have gotten a diagnosis and really be able to help them understand what this disease kind of journey looks like, what to expect, how to communicate with their loved one, because I know a lot of us, if you've had mom or dad in your life for 65 years and, they've been very sharp mentally, it's hard to recognize that they can't just remember, even reminding them, or
yes.
Mom, it's me, or Dad, it's me. So it's really learning how to communicate with your loved ones too, because it's not that they don't want to know who you are; they physically can't. So there's a lot of education that goes along with that with our social workers as well, and then they also help to plug those families in with resources that they might need.
Yeah, and you just said that you cover all but very few of the counties, and with that, do you have people stationed in each county, or how does that work?
Sure, and I want to be clear too, I should say that although our chapter is 73 of the 92 counties, the remaining counties are covered by the Alzheimer's Association. They're just they just flow into other chapters. So we definitely support, we provide support nationwide no matter where you are in what state, what city.
Awesome.
But we do not have staff in every county just because we have to be the best stewards of our donor dollars as possible.
Yes.
And so we have our primary offices in Indianapolis, and a lot of our staff travel out remotely to the other areas. But we also have satellite offices in Maryville and Fort Wayne, in which we have a development staff person in those areas as well as a social worker in those areas. And so all of our staff typically work a wide territory, if you will, to cover all the counties.
Gotcha. And you said that people often travel to different counties. How often do you guys have people on the road out visiting different houses and families?
Sure. I know that our social workers have like specific days of the month that they're, planning to be in certain cities. And so when we get calls in either to our office or to our 1-800-24/7 helpline, and we are able to set up one of those care consultations, then we try to do it really intentionally on days so that we can really, maximize our time with families in, the different areas around the state. But I would venture to say one of us is on the road almost at all times. We are a mighty staff of only 25 covering these 73 counties with a big range of responsibilities. And so we try to be as thoughtful as possible with our time.
That's awesome. And how do families reach out to you to get your help?
Absolutely. So I just mentioned our 1-800-24/7 helpline. That is an incredible resource that we're able to offer the community. When I say 24/7, that's 24/7, 365 days a year. You call our 1-800 number, which is 1-800-272-3900, and you will always get somebody on the other end, a trained professional on the other end that can answer questions that you might have about, how your loved one may be reacting, or, where to get a certain service for your loved one, or, what are our next steps. So that helpline is there because we know that, families in need don't just have needs during the hours of 9 and 5, Monday through Friday. So this allows for them, if they have a concern at 2 in the morning, they can reach out at that time and they'll always get someone on the other end. So that's a great way to connect with us. And another way to connect with us is through our website at alz.org, and you'll find a lot of resources there as well.
That's great. And you said your staffers are all professionally trained. What does that training look like?
Absolutely. So I had the pleasure of getting a tour of our call center when I was in Chicago a couple of months ago. Chicago is where our national headquarters is, and that's also where the call center is. Okay. So I know that every person that answers the phone goes through a minimum of 3 weeks of training. Everything from what our organization does to the resources that can be provided, as well as that sensitivity training, making sure that that we have a good dialogue with the person on the other end of the line. So I know it's a minimum of 3 weeks of training. And then it's also my understanding that in addition, on all shifts at the call center, we always have a licensed clinical social worker on staff too, because some people call that are in crisis mode, meaning, something big has happened with their loved one, maybe mom or dad or grandma or grandpa got out of the house and they don't know where they are. And so there's, a licensed professional then that can take that escalated call and really help that person in the time of.
Gotcha. And is it required that every staff member go to the national headquarters at least once?
That's a great question. Being relatively new to the organization, I'm not sure what that requirement is, but I guess I would frame it more as I do think that the opportunity is open. And actually, I guess I should say, there's a new staff orientation in our Chicago office, and so I think every staff person that works within the organization has the opportunity to visit the headquarters, at least when they first start, but I bet even on an annual basis.
Gotcha. Okay, now let's move on to the event, this upcoming run here in Indianapolis. Is this the first run of its kind in Indianapolis?
Sure. So, no, actually, our Walk to End Alzheimer's is our national signature event for the Alzheimer's Association, and it's been going on here in Indiana for almost 30 years. And it is the number one funder of our mission, because all of the things that we've talked about today, all of the the services that we offer are completely free of charge to families, and we will always try to keep it that way. And so the way that we raise funds to be able to help people is through events like the Walk to End Alzheimer's. So it's been going on for quite some time, but I will say that it is, we're getting more and more interest in the event, I think, which really speaks to the relevance of the disease right now, as well as the passion of the people that have walked that journey. Because the walk right now is the number 3 peer-to-peer fundraising event in the nation. So that means out of all the walks and where people are asking their friends and family to donate to the cause, we're number 3, which is huge. And I know just a few short years ago we were much further down on the list. So it's a cause that people are really passionate about.
That's great. And you said this is a nationwide event. How many cities does this take place in across the U.S.?
There are over 600 Walk to End Alzheimer's events nationwide. We have 12 in our chapter, which again includes those 73 counties I mentioned earlier, but also with the other, we have 3 more throughout the state. So we have a total of 15 Walk to End Alzheimer's events in our state.
Gotcha.
600 nationwide.
On that note, for listeners here in Pendleton, Indiana, are there any runs that are a little closer to home for them?
Absolutely. So we have probably the 3 closest events to our friends in Pendleton are the Indianapolis Walk that you just mentioned on October 6th at Bankers Life Fieldhouse in downtown Indy. Then we have one in Anderson on September 23rd at Hoosier Park Racing and Casino. And then finally we have a Walk to End Alzheimer's in Richmond, Indiana on September 29th at Earlham College.
Gotcha. Okay. Thank you so much for sharing that. What kind of support do you typically receive from the community on a run like this or in past years here in Indiana?
Absolutely. So our walks this year for the 12 that flow into the Greater Indiana chapter are expected to raise over $2 million to support our mission. And so of that, Indianapolis being the largest, we are hoping, we're working diligently to at minimum reach our $950,000 goal, but we are putting some extra emphasis to try to cross over the $1 million mark for the first time ever.
Wow.
And Indy last year was the 16th largest walk in the nation. It walked into Alzheimer's in the nation in terms of fundraising. And so, again, all in over $2 million for our mission.
Wow, that's great. And I know you were just talking about the funds and all this almost $1 million that you hope to bring in this year. Where does all that money go to?
Absolutely. So, like I shared previously, our mission is 3-pronged. So there's that research component, that care and support component, and then the promotion of brain health. And so all funds raised are channeled towards those 3 areas. And again, research is so critical right now because we're working towards that first treatment, that first intervention. Alzheimer's is the only disease in the top 10 causes of death for which there is no intervention, no treatment, no cure, no way to slow the disease. And so research is critical at this point to just help people that are going through this journey. In addition, the care and support that I mentioned earlier, so everything from our 1-800-24/7 helpline to our website services. One other thing that I should mention on care and support is we do have 65 face-to-face support groups throughout our Greater Indiana chapter. You can find those online, and so being able to meet our families where they are at least once a month face-to-face to give them that outlet so that they know that they're not alone in this journey. And then finally, that promotion of brain health is being out in the community and educating the public on what this disease looks like, because we know that early diagnosis is really the key for families to be able to plan accordingly and to provide them with the best outcomes as possible. That early diagnosis is critical.
Yeah, that's great. And I'm aware that along the route there will be multiple chances for participants to learn about the disease that is Alzheimer's. Could you explain what some of these opportunities will look like?
Sure, yeah. Each one of our walk kind of includes a mini expo, I guess, if you will. So we, when participants start joining the walks on the day of, they'll have the opportunity to, of course, check in and register, but then they'll have the opportunity to visit some of our sponsor booths and learn about the services and resources that are available to their families. And then during that time, we also have our own tables or tents set up representing the Alzheimer's programs and services. So participants are able to learn about where are those support groups in my community, what's the number to the 24/7 helpline, what are you guys doing in the world of advocacy, because we work on the state and federal level as well, advocating for legislation that is important to our families that we serve. And so those are all ways that people will be able to interact and learn more about our association on the day of event.
Yeah, that's great. And will participants have a chance to participate in any activities or demonstrations within the event?
Yes, absolutely. Our kind of the pinnacle or highlight of every Walk and Alzheimer's event is our Promise Garden ceremony. And so every walker on the day of event will receive a pinwheel flower, and there are 4 colors of our flowers, and they represent the participant's connection to the disease. So the blue flower represents someone that has Alzheimer's or dementia. Purple is for someone that has lost a loved one to the disease. Yellow means that you're currently providing care or support for someone with Alzheimer's or dementia. And orange means you don't have a close personal connection, but you believe in our mission and you believe in a world without Alzheimer's. So every participant will get their pinwheel flower, and during the Promise Garden flower ceremony, they'll be invited to raise their flower, showing their connection of the disease. And that really is a sense of community and shows the families that are there that have been directly impacted that they're not alone in this journey. It really provides a sense of community and connectedness, and so it helps people to have hope for the future as well.
Wow, that's great. And does that garden ceremony, does that take place nationwide, or is that an Indiana-specific thing?
Absolutely. It is nationwide. So you should experience that whether you're here in Indiana or, on the East Coast in New York or on the West Coast in California. You should, every Walk to Alzheimer's event should have a Promise Garden ceremony.
That's great. And could you tell us just when and where this event will take place?
Yes. So I'll just share the 3 cities that we talked about before. So the Indianapolis Walk will be on Saturday, October 6th, starting at Bankers Life Fieldhouse, and that event offers a 1 and 3 mile route for the participants. Anderson will take place on Sunday, September 23rd at Hoosier Park Racing and Casino. Registration time for that event is 1 p.m. And then the Richmond Walk will take place on Saturday, September 29th at Earlham College, and registration for that event takes place at 9 a.m.
Awesome, thank you. And can people still take part in each of these events?
Absolutely, yes. We technically do not close online registration until noon the Friday before those walks. So you can register all the way up until noon on Friday, October 5th for the Indy Walk. And the same thing for those other 2 events as well. And then if by chance you have some folks that didn't get signed up online before then, they can still join us on the day of event and register on site at the walk. So come all, everybody is welcome.
That's awesome. And then for those who don't know how to register, how can they do that online?
Yes. So probably the easiest way to view each of the walks in our chapter is to go online to alz.org/Indiana. And there will be a spot there that says register for the walk today. You click there, and then it shows all the 12 walks in our chapter. Or if you're looking for a walk outside of Indiana, you can go to alz.org/walk, and you can put in your zip code, or you can search by state for those 600 walks across the nation.
That's awesome. And if people are not available for these upcoming walks here in Indiana, is there another way that they can help the cause and help your organization?
Absolutely. I shared earlier that we're a small but mighty staff of 25, and so we would absolutely not be able to do the work that we do without our volunteers. So we have volunteers that do everything from working the water station at a walk to serving on the committee and making calls, to recruit teams, to helping with logistics to make sure that we're able to have walks nationwide. And so we work on these Walk to End Alzheimer's events pretty much year-round. And so there's always the opportunity to get plugged in through a volunteer role. But we also have many other volunteer roles within our association. We have community educators that go out and spread the word about what Alzheimer's disease looks like and how people can get involved and, what to be on the lookout for. We have people that help to write our blogs. We have folks that come in our office weekly and help with office work. So there are an incredible amount of volunteer opportunities. And folks can learn a little bit more about that by going to alz.org/Indiana again, and you can look for the volunteer button and learn more about the opportunities there.
That's great. And if people maybe don't have the time to volunteer, is there a way they can just make a donation?
Absolutely. We have folks, probably the easiest way to give is online. So there's certainly an opportunity to do that through any one of those walk websites. If you wanted to make an impact right there in your own community, you could go on to the alz.org/Indiana and find a walk in your area, or you can just go again to alz.org/Indiana, and up in the right-hand corner there is a teal donate button, and you can give that way as well.
That's great. And I know you said earlier that there are multiple booths around at these walks. Do you guys often receive sponsors for an event like these or any community outreach?
We do. We are so fortunate to have the support of lots of local companies and organizations throughout Indiana to support our mission. And we find that a lot of these companies are really anxious to help, or eager to help, I should say, and really want to help promote our mission in an effort to find that first treatment. And so we do. We have numerous sponsors in each one of the cities that we mentioned before, as well as throughout each state.
Awesome. Well, how can the folks listening here today stay up to date on the events coming up, or just stay up to date on your organization?
Absolutely. Well, generally speaking, if to find anything that's going on in our chapter, I encourage folks to go to alz.org/Indiana to find, to stay up to date on all the different walks, or to learn more about some of our other events in Indiana. And then, of course, if they want to learn something specific about any one of our walks, on that alz.org/Indiana landing page, click on walk from there, and then they'll see all the different walks in the state, and they'll be able to click in through to the walk website to see all the specific information, everything from location to times, to who the local contact is, to who are the participants, teams, and sponsors. So there's a lot of information on those walk sites as well.
That's awesome. Do you guys have any social media or any other ways people can catch up on what's going on?
We do. We have our Facebook page. If you search for the Alzheimer's Association Greater Indiana chapter, we do have a Facebook page. And then I know our Twitter handle is @AlzIndiana. So you can definitely keep plugged in with us via those two social media platforms as well.
Awesome. Well, thank you so much for joining me today. Do you have any more comments for the people listening?
I'm just grateful for all of the support that we get throughout the state of Indiana. And if you haven't ever been to a Walk to End Alzheimer's event, join us. Pick the event that's closest to you or closest to your family, and just join us on the day of event. Check it out. Learn a little bit more about what we're doing to combat the disease. learn more about how you can get plugged in. It's a really uplifting day. So, and the important thing with the walks to note too is there's no minimum to donate. There's no registration fee, nothing like that. So it's completely free of charge to come the day of. And our T-shirts are a prize, basically. So anybody that raises $100 or more will receive an official walk T-shirt. But every single person that comes out on the walk day will receive one of those Promise Garden flowers that we talked about before. And it just is a really uplifting day and shows the sense of community that we have all across the state. So join us for that. Also spread the word far and wide about our 1-800 helpline. So often we're sitting across from people that will say, I wish I would have known about your programs and services earlier. And so that number again is 1-800-272-3900. And then, of course, finally, our website, alz.org/Indiana. Absolutely. Thank you guys, too. Have a great day.
That's This Week in Community Connections. I'm Jack Hudson. Until next time.